Good mid-morning, all. This is Bill Wagner with Lunch Break. However, this is more of a brunch break. I'm recording this a little bit early as I have to head south and pick up my headset that I left at my office. So I hope you enjoy this. I hope you're enjoying your coffee right now, perking up and getting ready for another wonderful day. And today we're going to talk about wonderful sets of technology that are revolutionizing healthcare. And one particular technology above all others that I think is going to have a massive impact, again, back on my theme of small systems will rule the world. And this technology will enable that in ways you cannot imagine. So let's get started. 3D printers. 3D printers right now are used for four different things. First off, bioprinting tissues. So tissue replacements, artificial tissues that they can put on anything to patch up and seal wounds like veins, arteries on the heart. All of these now, they do not have to be ordered from some supplier far away. They can be printed right there where the procedure is going to be performed and printed rather quickly. Surgical instruments. If you think about hospital sterilization processes, there are numerous instances where flaws can happen, and there is a significant amount of potential for human error. However, you can print surgical instruments on a 3D printer probably for a lot less than you would buy them for on, say, whatever the medical version of Amazon is, and have them shipped to you. And the best part about that printing is those surgical instruments can be customized to the doctor and to the patient. So you can have a better surgical outcome because you're using the right tool for the job. The other one is custom made prosthetics using 3D printing. There's been numerous times where organizations have gone out and given free prosthetics to children or vets who suffered grievous injuries and needed a new arm or a new leg. And these prosthetics were created right there, right while the patient was sitting there next to the printing process, and they were customized and they fit perfectly. It wasn't a mass production issue, it was a simple 3D printing of a custom made ortho prosthetic that fit perfectly and was much cheaper. Whereas a prosthetic not printed and bought off the shelf might cost $1,000 up to $10,000. These could be produced for $500 and they work just as well, sometimes even better, and they certainly fit better than the ones you buy off the shelf. The other one is orthopedic implants, a new hip, a new knee, something along those lines where you need something that is made out of materials you know are high quality, are a perfect fit, and are made the day of the procedure. Yes, that's right. You could be sitting there working on your patient, and hot off the press, almost literally, is your orthopedic implant. Now, all of a sudden, your patient is fully capable and perfectly measured to receive this implant, is prepped to receive this implant. And the benefits and the quality, which we'll discuss in a little bit, are outstanding. So let's see where we can go with this. Let's take a look at cost and quality and some of the benefits of 3D printing because I want to interject this here. A 3D printer, it's not a factory. It is something you can buy and for as little as $300 if it's low volume and rather simple things you're building, or it is something that you can buy a much more complex machine up to $10,000. But if you think about it, if you're making it and the resin costs, let's say, let's throw it on the high side, the resin, which is whatever it is you're trying to make, is made out of the resin and the blueprints, let's say it costs you $500 to make an item. I want you to take that with a hip. How much does it cost your organization to buy the hip or the patient to buy the hip that they're going to have installed for in a lower quality way? Not saying the doctor's doing lower quality, but the fact is it's been transported, the patient's been up and around using their hip. Think about that for a minute. Think about other things you can print, simple plastic things like CPAP machines that you can print for your patients. And these kind of things you can do very inexpensively and pass that savings on to your payer and to your patient, allowing a higher volume and also allowing a distinction center where patients go, you know what? Everybody says they're the best. Well, as a small healthcare provider, what's that worth to you? There's a lot of value added for everybody in systems and technologies like this, game changers. So if you make your own stuff, how is it cheaper? Well, let's look at anatomic models. So surgeons are going to do complex surgery. It helps to practice beforehand, like in anything you do. So if you print an anatomic model and are able to practice the surgery, not only that, but to see things you could not see in the MRI scanner, the MRA scanner, the CT scanner. The printer prints all that off, and you can look at the anatomy and go, you know what? I would not have known that this tissue was so thin, or there was a break here on this bone. The MRI scanners can be challenging to read. They're two-dimensional pictures of a three-dimensional object. Here you're holding a three-dimensional object that is replicated off of a three-dimensional object. Now all of a sudden you can really see what's going on, anticipate problems in your surgery, and prep for that patient's surgery ahead of time. And the studies that are showing the value to this, $3,720 per case saved from reduced time, and surgical guides, 23 minutes saved at $1,488, 63 models. Think about how much volume your surgery center does, or you as a surgeon do per year. 63 models or guides per year, basically one a week, are predicted to be the minimum number to break even to account for annual fixed costs. That's resin costs, that's electric costs, that is the printer cost, all of those things. So if you do 1.2 procedures a week or more, you're going to break even. And that is a value right there that goes directly into your pockets as a provider. It can help out your payer, because payers are not bottomless pits of money. They actually need to direct money to providing services that bring higher quality outcomes, because in the end, that saves them money. So if as a payer, I see something like this and I'm like, you know what? They're doing this, I'm going to direct my patients to them because I know they'll have higher quality outcomes. And if it's only 1.2 per week to break even, that means even the smallest center, the smallest surgery center, the little guy in this field of mergers can really stand out strong and prosper. No need to look at mergers, no need to look at acquisitions. You can thrive with complicated surgeries and complicated cases based on this alone. And this again feeds into that the small players are going to rule the world. So let's keep talking and let's see what other things we're going to do for less. And one thing I do want to point out here is that if you look at things like DME, things like canes, things like orthotic implants for shoes, things like equipment to go on a CPAP machine, all of which is very standardized. Well, the orthotics are customized to that shoe, but still, you're the one taking the measurements. You could send them out to a DME supplier to get these things. But my CPAP machine, which probably had about $10 worth of extruded plastic and design time in mask, hose, fittings, stuff like that. Probably more like a charge of $500 per month for my insurance company. Now, how much of that equipment run do you have to pay for to get it in and then to sell to the patient versus maybe $10, $15 worth of material and printer time to make it yourself and sell at a much lower cost and still make a higher profit margin off of it. There's a lot to be said for higher profit margin versus higher payment type. If it's costing you $450 to get these supplies in and the insurance company's paying you $500, you're only making $50. But if it's costing you $10 to $15 and you're charging $100, you're making $90 to $85. Well, that's a step up in the right direction. It benefits you, it benefits the payer, and it benefits your patient. So look into everything around you and say, if I could print that, I'd save a lot of money. And that's what you need to start with this technology. Now, the quality is high. 27% of hip surgery revisions are due to poor fixation, and biomedical reconstruction of the initial implant. If you were to personalize it, patient-specific implants measured specifically to that patient, customized, and at much lower cost, were printed right there. And that patient isn't dancing and shifting around. Well, they might not be dancing, but they could be moving around. They could have fallen. It could have shifted how the measurements look. You can print out where the joint's going to fit. You can make sure the measurements are super hyper precise because that's how these machines work. You're increasing quality, increasing patient satisfaction, reducing time to recovery, and everything that does that falls under this is better. You're reducing hospital and post-acute care costs, physical therapy is less. That means more patients are coming to you. That means higher patient satisfaction and also reduce costs and recovery. And with value-based reimbursement being what it is out there, lower cost translates into more money for you as a provider. And as an insurance company, you should be encouraging this because, quite frankly, it lowers cost of care, increases quality, and on top of that, provider profit margins can go up. And so even though they're not getting $5,000, they're also not spending $4,990 to get this result. They're spending a few hundred, maybe 1,000, depending on the type of machine and how many are being done. So this is all essential. Cost savings, it takes time for the volume to reduce the cost, but that volume is skyrocketing right now. And you can jump on board and get these machines because it's not medical that's buying it up. It's the auto industry. It's the tech industry. So they're driving costs down. They have the same precision rates, and all you got to do is load in a blueprint. The joints fit better. They have a lower failure rate. And in a few years, the cost is going to be way down. And you can be on a cutting edge trend. And no matter how you look at it, you come out ahead. This technology is saving lives. It is improving services, and it is driving higher quality of care at lower cost. It is these technologies that we need to focus on to better the American medical system and make it work for everybody. I thank you for your time on this lunch break. I hope you have a great lunch and you all have a wonderful rest of your day. If you got comments, leave them below. If you got statements, leave them below. Let's start this discussion.